Specialized training allows us to take care of people with a variety of issues, including pelvic pain, incontinence, pelvic organ prolapse. We see people pre and postpartum, people of all stages of life. Well, we get referrals from a variety of physicians, and sometimes our interventions can be very helpful and lead to them not needing other interventions like surgical interventions. We do see people post-surgery too. We treat a wide range of conditions. It can be urinary incontinence, stress or urge, mixed incontinence, fecal incontinence, overactive bladder. There's a multitude of pelvic pain conditions that can happen after UTI. Sometimes the symptoms can mimic UTI. Pelvic organ prolapse and how to manage that, and how to be able to resume exercise safely. So there's a whole wide variety of things that we can treat. The treatment is more based on what's found in evaluation than the actual age of the patient. There can be weakness, there can be muscle tightness, a variety of things. They're not more common at one age than another. The specific needs would not really be related to the fact that they're postmenopausal. It could be an incontinence issue, it could be a pelvic pain issue. That can also happen with somebody who isn't postmenopausal. It varies from person to person. Sometimes it's only a few treatments will take care of the problem. Other times it takes longer depending on what is going on in the findings, but often it's just a couple treatments. Women who are pregnant sometimes have issues with pelvic pain. There's a lot of changes in the body. You can get pubic symphysis diastases that begins and creates a lot of pain. So we can give them some pointers to managing that. We can also see them postpartum if the symptoms continue after that. There's a lot of PT interventions for urinary incontinence. Sometimes it's a simple matter that the muscles aren't strong enough, and by retraining, also strengthening core muscles, we can improve that. Other times it's actually a matter of muscles being too tight or too tense and not being able to relax enough to fully void. Sometimes it's just a matter of habit and bladder retraining. Sometimes it's a combination of all of that. What I like best about my job is that sometimes very simple things can make the world of difference for somebody. Very simple interventions sometimes can help with symptoms that people thought they were going to be stuck with forever and that nothing could be done about. What I think differentiates our pelvic health program from other sites is that we have control of our schedules and we are allowed to spend as much time as it takes with people. We're not under a pressure to make sure that everything is done within a half an hour. We're allowed to spend an hour with somebody if need be. And also working closely together with the physicians that are a referral basis. So I think we can provide better care for people because of those reasons.